A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronaviruses are not dangerous. Some types of them are serious, though. About 858 people have died from Middle East Respiratory Syndrome (MERS), which first appeared in 2012 in Saudi Arabia and then in other countries in the Middle East, Africa, Asia, and Europe. In April 2014, the first American was hospitalized for MERS in Indiana and another case was reported in Florida. Both had just returned from Saudi Arabia. In May 2015, there was an outbreak of MERS in Korea, which was the largest outbreak outside of the Arabian Peninsula. In 2003, 774 people died from a severe acute respiratory syndrome (SARS) outbreak. As of 2015, there were no further reports of cases of SARS. MERS and SARS are types of coronaviruses. But in early January 2020, the World Health Organization identified a new type. 2019 novel coronavirus 2019 nCoV in China. By late January, there were 300 confirmed cases in China and a death count that was still in the single digits, but rising. And despite airport screenings, a traveler had brought the first case to the U.S. Often a coronavirus causes upper respiratory infection symptoms like a stuffy nose, cough, and sore throat. You can treat them with rest and over-the-counter medication. The coronavirus can also cause middle ear infections in children. What is a coronavirus? Coronaviruses were first identified in the 1960s, but we don't know where they come from. They get their name from their crown-like shape. Sometimes, but not often, a coronavirus can infect both animals and humans. Most coronaviruses spread the same way other cold-causing viruses do. Through infected people coughing and sneezing. By touching an infected person's hands or face. Or by touching things such as doorknobs that infected people have touched. Almost everyone gets a coronavirus infection at least once in their life, most likely as a young child. In the United States, coronaviruses are more common in the fall and winter, but anyone can come down with a coronavirus infection at any time. How do you treat coronavirus? You treat a coronavirus infection the same way you treat a cold. Get plenty of rest. Drink fluids. Take over-the-counter medicine for sore throat and fever, but don't give aspirin to children or teens younger than 19, use ibuprofen or acetaminophen instead. Transmission. MERS-CoV, like other coronaviruses, likely spreads from an infected person's respiratory secretions, such as through coughing. However, we don't fully understand the precise ways that it spreads. MERS-CoV has spread from ill people to others through close contact, such as caring for or living with an infected person. Infected people have spread MERS-CoV to others in healthcare settings, such as hospitals. Researchers studying MERS have not seen any ongoing spreading of MERS-CoV in the community. All reported cases have been linked to countries in and near the Arabian Peninsula. Most infected people either lived in the Arabian Peninsula or recently traveled from the Arabian Peninsula before they became ill. A few people have gotten MERS after having close contact with an infected person who had recently traveled from the Arabian Peninsula. The largest known outbreak of MERS outside the Arabian Peninsula occurred in the Republic of Korea in 2015 and was associated with a traveler returning from the Arabian Peninsula. Public health agencies continue to investigate clusters of cases in several countries to better understand how MERS-CoV spreads from person to person. Symptoms and complications. Most people confirmed to have MERS-CoV infection have had severe respiratory illness with symptoms of fever, cough, shortness of breath. Some people also had diarrhea and nausea, vomiting. For many people with MERS, more severe complications followed, such as pneumonia and kidney failure. About 3 or 4 out of every 10 people reported with MERS have died. Most of the people who died had a pre-existing medical condition that weakened their immune system or an underlying medical condition that hadn't yet been discovered. Medical conditions sometimes weaken people's immune systems and make them more likely to get sick or have severe illness. Pre-existing conditions among people who got MERS have included diabetes, cancer, chronic lung disease, chronic heart disease, chronic kidney disease. Some infected people had mild symptoms such as cold-like symptoms or no symptoms at all. The symptoms of MERS start to appear about 5 or 6 days after a person is exposed, but can range from 2 to 14 days. Prevention and treatment. Prevention. There is currently no vaccine to protect people against MERS. But scientists are working to develop one. You can help reduce your risk of getting respiratory illnesses. Wash your hands often with soap and water for at least 20 seconds and help young children do the same. Cover your nose and mouth with a tissue when you cough or sneeze, then throw the tissue in the trash. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid personal contact, such as kissing or sharing cups or eating utensils, with sick people. Clean and disinfect frequently touched surfaces and objects, such as doorknobs. Human coronavirus types. Coronaviruses are named for the crown-like spikes on their surface. There are 4 main subgroupings of coronaviruses, known as alpha, beta, gamma, and delta. Human coronaviruses were first identified in the mid-1960s. The 7 coronaviruses that can infect people are common human coronaviruses, 229E alpha coronavirus, NL63 alpha coronavirus, OC43 beta coronavirus, HKU1 beta coronavirus. Other human coronaviruses. MERS-CoV, the beta coronavirus that causes Middle East Respiratory Syndrome or MERS. SARS-CoV, the beta coronavirus that causes Severe Acute Respiratory Syndrome or SARS. 2019 Novel Coronavirus 2019 nCoV. People around the world commonly get infected with human coronaviruses 229E, NL63, OC43, and HKU1. Sometimes coronaviruses that infect animals can evolve and make people sick and become a new human coronavirus. 3 recent examples of this are 2019 nCoV, SARS-CoV, and MERS-CoV. The Centers for Disease Control and Prevention (CDC) is closely monitoring an outbreak caused by a novel, new coronavirus first identified in Wuhan, Hubei Province, China. Chinese authorities identified the new coronavirus, which has resulted in hundreds of confirmed cases in China, including cases outside Wuhan, with additional cases being identified in a growing number of countries internationally. The first case in the United States was announced on January 21, 2020. Prevention. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. These are everyday habits that can help prevent the spread of several viruses. CDC does have specific guidance for travelers. Treatment. There is no specific antiviral treatment recommended for 2019 nCoV infection. People infected with 2019 nCoV should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to 2019 nCoV should contact your healthcare provider immediately. Thank you for watching. Please don't forget to subscribe Daddy Robs.